canceling everything when nothing is happening. So I am going to share my screen here. All right, are you seeing my PowerPoint? Yep, okay, perfect. All right, I'm trying to move some stuff here. Okay, perfect. All right. If folks could just put themselves on mute, that'd be great. Thanks. So as Kristen said, I am from the Center for Health Law and Policy Innovation of Harvard Law School, where we advocate for legal, regulatory, and policy reforms in both health and food systems, with a focus on the health, public health, and food needs of systemically marginalized individuals. Additionally, we are also a clinical teaching program at Harvard Law School, so we teach students to become skilled, innovative, and thoughtful food and health system practitioners. I'm a clinical instructor and attorney at the center, where I really focus on policy advocacy and technical assistance to address the social determinants of health and health equity for populations experiencing chronic illness. And my work does that by advancing the integration of health-related social needs into our healthcare system. So things like food and housing supports. For the past year or last year, this work included advising the formation of the New York Food as Medicine project, which was a statewide initiative to develop policy and practice recommendations for the future of food as medicine in New York State. And just a fun fact, prior to joining Harvard, I was a staff attorney at the Legal Aid Society in New York City for nearly 5 years. So, you know, I love giving presentations and working in New York. It brings me home. So thank you for having me. So today we're going to talk about, as Kristen said, the New York Health Equity Reform 1115 Medicaid Waiver Amendment, which was just approved on January 9th. So you all are getting kind of some hot off the presses information. Okay. So today we're going to kind of talk about 3 main topics. Big picture, I just like to start off with like food as medicine defined. I know that this might be some review, but I find it's helpful level setting. We'll talk about like, why are we even talking about these things called waivers that seem honestly quite confusing. Then we'll talk about like, what are these 1115 waivers? What's kind of the national landscape going on around these? And then we'll dig into some details about New York's specific waiver amendment. And then we'll talk about some opportunities for you all at Eat Well to engage in some advocacy and to actually engage in the waiver itself. So just for some level setting, you know, food as medicine interventions are really tailored to respond to that connection between food and health. And there's 2 components of that: the provision of food to support health, right? So usually the direct provision of food, or like a voucher to access food, and a nexus to the healthcare system. And that's really important because we're going to be talking about Medicaid. And so these are the interventions that Medicaid's actually going to pay for. So on this pyramid here, we're talking about these top 3 interventions here, things like produce prescriptions, medically tailored food packages, and medically tailored meal programs. And these build off of and are supported by things like government nutrition security programs. So things like SNAP and WIC, and population healthy food policies and programs. So things like healthy food labeling. So SNAP, WIC, healthy food labeling, right? Those are things that Medicaid won't pay for, but they're definitely really important policies that support these things that Medicaid will pay for. And just to add on to that, food as medicine interventions address specific health needs of different focus populations based on their acuity and other factors, right? So for instance, like medically tailored meals address people with kind of higher acuity, so individuals who may not be able to shop and cook for themselves, whereas produce prescriptions, vouchers to actually access healthy produce, and other types of healthy food, those individuals are likely able to shop and cook for themselves. So kind of lower acuity things like maybe more controlled diabetes. So, a lot of us in this room, we know that many social determinants of health interventions can have a powerful impact on health outcomes and costs, right? Up to 80% of medical outcomes are actually driven by the social determinants of health as opposed to medical interventions. But historically, financial support for these services has been provided on a limited or pilot basis by private sources, which can limit the availability of the actual services. And there's no current coverage of food as medicine services or the direct provision of food beyond really limited circumstances in our baseline Medicaid coverage or in original Medicare, which we're not talking about today, under federal law. So we have to utilize kind of these legal and regulatory flexibilities in order to get them covered through healthcare. And Section 1115 in the Medicaid law, the Social Security Act, can actually provide that sustainable healthcare funding for these types of interventions. So what is Section 1115 and these Medicaid waivers? So they're actually quite broad, right? They're not only for the social determinant of health interventions or what are called health-related social needs services. So with CMS approval, states are able to implement experimental pilot or demonstration projects. So for instance, they can cover services like food as medicine services and populations of people that are not typically allowed to be covered under federal law. And with that, the states have to follow several requirements. So these demonstrations have to promote the objectives of the federal Medicaid program. They have to be budget neutral to the federal government. That means that the cost to the federal government with the waiver have to be the same as if the state hadn't had a waiver at all. But there are flexibility for certain health-related social needs services, which is really nice for the state. And we'll kind of get into that. These are not permanent changes to the Medicaid program. So initially, CMS typically approves these for 5 years, but they can be renewed for 3 to 5 year periods. And some states, like New York, often renews these for years and years and years. You'll see that New York's Section 1115 Medicaid waiver has been running since 1997. States have to contract with independent evaluators to conduct evaluations on the outcomes of these waivers, and they have to provide CMS with reports on those outcomes. So some pros of these waivers is that they can establish statewide access to these services, unlike some other pathways for these services. They provide infrastructure funding, which is additional funding for the states, for Medicaid plans, for community-based organizations and other stakeholders, for things like technology, development of business or operational practices, workforce development, outreach, education, and stakeholder convening, so that these services like food as medicine services, housing services can actually be delivered, which is wonderful and very unique. There's some cons though, right? This cost neutrality component, this budget neutrality component, although it is more flexible for health-related social needs services, and they have to be renewed, right? So that lack of permanence. We'll go through this rather quickly, but to kind of situate New York in the national landscape, there's been major support from the federal government for the use of 1115 waivers to further things like food security and the food is medicine intervention. So in September 2022, the Biden-Harris administration released a national strategy on hunger, nutrition, and health. And that strategy endorsed the testing of Medicaid coverage for food as medicine interventions through these 1115 waivers. And CMS committed to helping states with this process through guidance. And they've really made right on that promise. In December 2022, CMS released this framework for successful state proposals to cover health-related social needs services, including nutrition supports, food as medicine interventions, and housing supports. And then in November 2023, CMS released further guidance detailing coverage pathways for services and supports to address health-related social needs services. 20 states have approved or pending 1115 waivers that include nutrition services. 11 of those include the direct provision of food. So you'll see here, New York is on that list. And the majority include other services such as housing supports, transportation, and services to address interpersonal violence, which is just very interesting and great. And New York is the newest approval. Hawaii is the newest proposal. Okay, so let's dig into New York's waiver amendment that was approved on January 9th. So what's important to understand about New York's waiver amendment is that it is huge. So it amends New York Section 1115, what's called the Medicaid Redesign Team waiver, which, like I said, has operated since 1997, and it's been just extended several times and amended several times. And this amendment includes several kind of separate but interconnected initiatives. So the first one is the Health-Related Social Needs Initiative. The second is the HERO. The third is a Medicaid Hospital Global Budget Initiative. And then the last is Strengthening the Workforce. So not all of those are relevant to what we're going to be talking about today. I'm going to focus on the Health-Related Social Needs Initiative and the HERO initiative, but know that there's other initiatives covered in this waiver. So there's key components that I'll summarize today of those two initiatives: services, target population, implementation, and monitoring and evaluation. What's also important to keep in mind is that the details of this waiver are not all the way worked out yet, right? So the state has to submit an implementation plan to CMS by October of 2024. So the state's still going to be working out a lot of details. They're going to be releasing a lot of guidance. They're going to be working with stakeholders on actually what the implementation of this waiver is going to look like. So right now we have some details from this document and from further documents that are going to be released, but a lot of things are still being worked out. So we don't have all of the answers yet. What we do know are some of the services that are going to be included. So some services for nutrition supports that are going to be covered include nutrition counseling and education, prepared meals approved by a registered dietitian nutritionist. So these are like medically tailored meals. We have medically tailored or nutritionally appropriate food prescriptions. So like fruit and vegetable prescriptions or like home delivered grocery boxes. We have fresh produce and non-perishable groceries. This is more commonly known as like pantry stocking, and this is available to pregnant persons and children. We have cooking supplies, which is really exciting. And then private and public transportation. So the transportation that individuals need to actually access these services, which is a really fantastic kind of explicit service for New York to be covering. Also, the New York waiver is the first waiver to kind of explicitly include guidance that was issued by CMS in November 2023 that I mentioned. So it's important to note that beneficiaries cannot receive more than one direct food support at the same time. So, for example, a beneficiary who receives a food prescription or a produce prescription cannot also receive meals at the same time. Also, this is the first time that we've seen, articulated that additional nutritional support for the household is available if the beneficiary is a high-risk pregnant individual or a high-risk child. That's really wonderful. Massachusetts, for instance, has household benefits for a high-risk pregnant individual, but the extension to a high-risk child is really wonderful. Nutritional interventions are initially available for a 6-month period, but they can be renewed for additional 6-month period. Individuals with high-risk pregnancies have an initial period that is longer than 6 months, which is really wonderful and acknowledges, right, the realities of how long a pregnancy is, right? Target populations are still being determined. There's level 1 services. All Medicaid beneficiaries are going to be screened and referred to existing programs. So things like SNAP and WIC, right? Any available health-related social needs programs, which is really wonderful. Level 2 services are going to be these things like nutrition supports, right? And so these individuals have to be enrolled in Medicaid managed care, and then they have to meet certain criteria that are yet to be defined. So that's important to note that these terms list some possible target populations, but the state is still going to be defining them in documents to be released later. Okay, implementation. The waiver includes up to $500 million of infrastructure funding to support the availability and quality of these services. So if you remember, this is extra money that's going to go to the state, to Medicaid managed care plans, to community-based organizations that are actually delivering the services, and other stakeholders to help with things like technology and workforce development, which is really wonderful. The state's also going to contract with a single statewide independent hero, they're calling it, that's going to conduct kind of statewide needs like data aggregation, regional needs and assessment planning, and program analysis. Importantly, the state's also going to award one social care network per region, up to 5 in New York City, to be designated as the Medicaid provider or lead entity to coordinate all of the CBOs in that region that are providing health-related social needs services. So all of the CBOs that are providing those nutrition supports and housing supports and transportation and provide health-related social needs screening and referral services, help them with billing and things like that. Importantly, though, the state is going to set those health-related social needs services service rates, right? So what the community-based organizations who are actually providing the nutrition support services, right, actually providing the grocery box or actually providing the medically tailored meals, how much they get paid. Reminder that the state has to submit its implementation plan by October. So we're going to know more of those details by then. And I'll talk more about the social care networks in a bit. And then, of course, the state has to pick that independent evaluator who has to track and report things like the beneficiary or health-related social need data, things like how has the information technology infrastructure, right, between CBOs and that hero and the social care networks, how has that been implemented? And they also have to track things about the % of Medicaid beneficiaries who have been enrolled in other public benefit programs, and they actually have to show that they've been improving that. Finally, I want to highlight some important engagement opportunities. The RFA, the request for applications for the social care networks, have been posted. The applications are due March 27th. So these are really for the lead entities, right? Those people who will be responsible for coordinating all of the CBOs in a region. I want to emphasize that this is not your only opportunity to provide services under the waiver. This is only for individuals who want to coordinate all of the CBOs in the region. So if you just want to provide services, you'll work with that social care network, but you don't have to be the social care network actual lead entity. But if you know who's applying for the lead entities and you want to throw your weight behind somebody, like you as Eat Well or you as an organization could write a letter of support. If you want to influence the process, you could talk to them and say this is an aspect that's really important to me, etc. Also, the New York State Department of Health is going to be posting a webinar recording that they're answering questions that they solicited from the public. I will admit that this date keeps changing. Initially, they said they were going to post on Monday, and now they're saying that they're going to post on Friday. So that's the last time I checked, they said they're going to post on Friday. So I've listed where they said they're going to post it. They're going to talk about not just these two components of the waiver that I talked about, but all four. Finally, here's some action items that kind of always stand as things that you can do. Early lessons from other big health-related social needs waivers. So in North Carolina and California have shown that, CBOs, providers and plans and other stakeholders have been most successful in implementing coverage when they have some existing Medicaid partnerships, right, and infrastructure prior to implementation. So you can be working on that now, right? You don't have to be engaging directly with the waiver. You can start working on those partnerships. So you can start working on educating your provider, and I think provider network. So, something that was really important from California is that, they started implementing their waiver, they got everything up and going, and then they realized that their providers, right, their primary care providers, for instance, were not referring to their health-related social needs services. And so they had a really low program uptake, right? No one was getting the food as medicine services in California. So they had to go out and educate their providers. So in New York, you could start to leverage the White House Conference American College of Lifestyle Medicine continuing education programs that have to educate about nutrition, for instance. You can start working in coalition like you're doing now with Eat Well, and I listed several other kind of state and regional coalitions in New York that are working together on these issues. And then you can partner in Medicaid. So if you have partnerships with Medicaid managed care plans, you can start working with them now in Medicaid. And then you can start building your Medicaid infrastructure now. The 2024 budget included expanded Medicaid coverage for nutritionist services and community health worker services, for example. So those individuals can start providing services as Medicaid providers. And you may need to start developing new expertise, for instance, in HIPAA, and I've linked to a really helpful resource there. So this is just a helpful takeaway, start engaging in those heroes, those social care networks, those groups that are applying for those in the evaluations. If you know folks who are going to be evaluating, or if you have folks that are evaluating your programs, you can start engaging decision makers at the Department of Health and other stakeholders, like I said, providers and plans, community members, if you have ideas of how this program should be run. And then just summarizing that last slide of educating providers, activating your coalitions, engaging in Medicaid partnerships, and continuing to build up your infrastructure so that you can implement and take advantage of this new funding because it's upwards of $10 billion. billion of funding that's going to be kind of flowing into the state and investing in these programs.